Most people don't know that we have actually 2 different entities at this location. So there's the health department, and then there's also, we had a home health agency as well. And so when I first started, I was the RN over the home health services. And back in that time, eligibility for home health services to be paid by insurance was a lot more broad in coverage. So people could be on services for years. Then in the latter 90s, things changed. People weren't on services as long. Eligibility, the umbrella of coverage basically narrowed. So that changed. We saw a lot more people on for Medicaid home health services, not as much Medicare. And continued evolutionary change. The referrals have decreased. Clinical care is different. Orthopedic surgeries, we used to always get those people like total hips, total knees. Nowadays, people go in and get anticipatory guidance and training before their surgery date, and they usually do it as a group. They learn about techniques, physical therapy and stuff before they have the procedures. So now when they come home, they really don't need the help. So there's just been a lot of different things that have changed. Medicaid switching to CanCare in Kansas, we definitely had a significant decrease in referrals in that aspect as well. So we ended up in just actually about a month ago, it was decided to let go of the insurance billing portion of our home health agency. We just didn't have enough referrals. There's a lot of overhead administrative burden. And we do continue with private pay though. So at least there are some home health services in our county, because those services really can help a lot of seniors stay home longer and safely in their home, be still an active part of their community, rather than having them be pulled from their home and maybe taken to where the kids are. Because a lot of times kids don't live local. Mom or dad still live here, and the kids move away. So we've still provided home services to about 60 people, varying from just doing foot cares to going in and seeing them 5 times a week. Private pay services includes housekeeping, helping patients with personal cares like bathing, getting to and from doctor's appointments, that type of stuff. Things that really can help people stay in their homes a lot longer. It's not necessarily profitable, but we're here for public service. And sometimes the return on investment is more about the long-term savings than what it is about short-term bringing cash back into the account. I always like to look at it too. A lot of times these are our seniors, they're the people that have actually been paying taxes the longest. And they kind of deserve to get something back. It not only keeps them in the community, but it keeps them healthier longer. And I had a patient that I took care of a long time ago. She actually lived to be 104. She was one of the most amazing people I had ever gotten the pleasure to know. Talking to her about the influenza pandemic in the early 1900s, and her taking care of her family, the 2 world wars. I mean, it was amazing to hear her story. And one of the things she said that I've always remembered ever since is she always said, "Never forget, my dear, health is wealth." And it's true. So we look at that as being, that's our investment to the community. We have, as far as if you include contractual staff, it's about 8.2 full-time equivalents, 7 full-time staff. And that's divided between the 2 departments, respective to public health. Primarily those services are offered more so in our office, and then we have the home health services that we do as well, which are delivered obviously out in the home primarily and in the community. We definitely help with transitional care. Example of what that really is say you have an individual that's been in an acute care setting where they've been in a hospital and they're transitioning back to the community. A lot of times you think you're doing pretty good in the hospital, but it's very different being there when you have people helping you. And then you try to come home and you find things are difficult to do on your own. Maybe you're a little more weak than what you had anticipated, and you can just use some extra supports. So we definitely help coordinate with our local hospital and the clinic. Also, they may see somebody that's at home living alone, and they can start to see they're declining in their health. Maybe they have some new conditions that have come up. We are able to go in the home, do teaching, those types of home supports to optimize their health and their conditions. Those are done through the health department, and those types of services are just one facet. We do those blood draws twice a year at our facility. We coordinate that with the local hospital, and we offer them at greatly reduced cash rates. The doctors actually also will schedule their patients' visits or follow up for lab for those people that have no insurance or they're limited income, so that they time those labs to be done when we provide those services at that cheap cost. We've helped a lot of individuals catch some very life-threatening and some serious conditions. We usually have stories from each time validating the importance of why we do it. On average, we have about 130 participants. I think the top time was, of course, Kansas. It had been a snowstorm, a blizzard the night before, because it was in February, is one of the months we hold it. And I almost canceled it and decided not to. That was our top participation. So leave it to Kansans that the weather is the most miserable, and that's when we had the most people participate. I think it was 182 people participated that day. And that's just one facet that we do. We also provide WIC, which is the Women, Infants, and Children Supplemental Food Program. We provide that federal program for not only Norton County residents, but also for Decatur County. They had a service gap, and we were approached to go into the county and deliver the service. And because it's a contiguous county, a lot of people are bringing their healthcare needs to Norton as well because of our hospital and clinic, and especially because we have a delivering hospital. We provide obstetrics here at the hospital. It seemed to be a logical fit. And since then, its participation has grown, and a lot of people from Decatur actually are coming over here, not only for WIC and their medical, but also for other shopping and whatnot. So it's been an economical, wise choice for us to do, not only providing the service, but it also had economic benefit to the county as well. We also are the only ones that provide vaccinations, and that includes all required infant, child, we do adolescent, adult, and even traveling vaccinations. And that's a very well coordinated effort between us and the clinic and the hospital. We don't compete against one another, we instead try to complement one another's services. And so we do the bulk of that. Probably on average, we do about 3,200 vaccinations a year. And it's anywhere between that to 3,200 to 3,600. And mind you, we're only a county of like 5,500 people. So we see a lot of people. That's obviously not an unduplicated census. Unduplicated, that's probably about 1,500 to 1,700 people per year. So we run a lot of vaccines through this place. And vaccines undoubtedly are inarguably one of the greatest advances of public health. You look at polio, we've eradicated polio. You look at the damage to life and also to quality of life that was sustained from diseases such as that we've since learned how to basically eradicate. So vaccines are well worth investment. The other thing that's nice about us providing it is you can talk to people from other states respective to where they go in the process for getting vaccinations. Here we are a walk-in clinic, so you can come, as long as you provide your insurance information, we can go ahead and usually serve you that day. I know I have a sister that lives in another state. She literally has to take like half the day off because they maybe only have a vaccination clinic on set days in another town. So she has to leave work, go get back, sit in a mass lobby clinic, wait for their turn. So it's also a huge convenience in regards to how we deliver the service for the residents of the county. I'm old enough. I remember the days when we first got internet. I remember floppy disk days. Yeah, I'm showing my age now, but definitely Nex-Tech, one of the first steps that we made in regards to that relationship was adding in a business phone line. It definitely helped us manage as far as having the capabilities for voicemail, even simple things like call forwarding, different capabilities such as that helped us not only with internal office management, but also externally for like when we had on-call services, that type of stuff for our home health. In more recent days, probably the most significant changes I've seen has been in regards to using total backup. Part of being a healthcare entity is we have to have capabilities for continuity of service, be it a disaster, whether it be natural or whatnot, capability so that we can basically get geared back up again and serving the community, that was a huge asset. I can think of the past, we used to use external drive backups, which was a joke because your drives were at the same location as your facility. Once a week we had to take those drives, take them somewhere else. It was a lot more of a burden, and it would have been very time consuming for us to get back up and operable again, versus now really it's going to take longer for us to get the hardware here than what it is to get actually the data and everything loaded. Another huge advantage has been using the total security. In the past, it was difficult with having about 10 different computers and a server here to keep up on everybody's certificates, the antivirus, all of those types of things. It doesn't sound like a lot, but we're a small department, and it was just more things to manage. Having total security, don't have to worry about that anymore. Through the business concierge service, I feel like I have a partner that's helping me meet my obligations of privacy and security, in the fact that they'll give me a call if they notice activity or threats. So it's really like feeling like you have somebody that's doing that work for you all the time, and really providing that extra layer that we as a small department, a small entity, we don't have the capabilities to have in-house IT doing that for us all the time. To know that if one of the smartphones that we have linked with email gets stolen, lost, I have one phone call to make, and that phone can be wiped, and therefore my responsibilities of assuring privacy and security have also been met as a huge relief for my position. We use them also, Nex-Tech we use for hosted exchange with total email. That's another layer of security because of the encryption services that are provided through that as well. Another thing that I've been able to tell is even though we have to pay for monthly maintenance, we have far less crisis issues in regards to our IT. I can't tell you the last time I've had to have somebody come in and deal with a crisis moment. For us, a crisis moment is a lot of the programs we operate are web-based. If there's something wrong with the system and we can't access that, we literally cannot serve our customers, or at least not serve them as effectively. So that monthly investment has been well worth the savings in regards to having IT actually come on site and fixing problems, so we don't have interruptions to business.
We do firewall management, email, take care of their server, antivirus, pretty much everything to do with their IT. That's part of their antivirus product. The email, we have hosted exchange, which is the email that they use that offers encryption, which is big in the health field. You need to be able to encrypt stuff. Their firewall, we own the firewall, we take care of it, we manage it for them, make sure that nobody can get in that shouldn't be able to get in. Their server they currently have, they owned previous to us. We just manage it for them, make sure it's okay, take care of it, install updates, all that stuff for them.
Scale of 1 to 10, it's 10. Not only for us internally, but also then indirectly for the customers that we serve. If you come in and you need to have vaccinations and we can't access our web-based systems to determine exactly what vaccinations a person has or hasn't had, we can't do service. And also, in regards to what a factor people don't know about is we have a lot of obligations in regards to emergencies and disasters. Nex-Tech also has met some of those compliance issues that we need. As far as our phone bank has extra slots available, Nex-Tech has agreed that they would help us within 24 hours set up those additional banks if we need them. Also, just knowing that we have the business concierge, we have first name basis with the individual that got us set us up in the first place, Curtis Flax. If he's available, he's right there. I can email, I can call him, I can talk to him. Even if he's not, there's somebody else that's available. But to have that face, that name that knows you, that knows your business is priceless. I don't have to explain anything to him. Curtis knows because he's the one that set us up. Another service that we use, I mean, I realize this is more of a specialty service, but because of all the vaccinations that we do, we have tens of thousands worth of dollars of vaccine in a refrigerator and freezer. Should power supply happen, mechanical failure, and say it happens over an evening or on a weekend, we could stand to lose thousands of dollars worth of inventory. We also use the alarm monitoring system. so that it will call out to, I think there's 3 of us that are built into the system that will alert us, and obviously it's successful in the fact that it doesn't stop calling or attempting until somebody is actually reached, so that we can assure the safety of our vaccine inventory.
It's a lot of knowing what the laws are and what you can and cannot do, who can access what, and for what reasons, and documenting all that. Some of them are doing that. Some of them have their own internal HIPAA person, whatever you want to call them. The ones that we work with primarily, they're small enough hospitals or health departments or health places that they can't afford to hire a full-time IT person, and that's where we come in. Kind of both. Yeah, we need to know the laws and rules and how it all goes, and make sure that, like for our data and stuff, we do their backups as well. We have to make sure that our data center's then HIPAA compliant as well.
For us, a lot of our systems have actually moved to web-based, so we don't necessarily house a lot of data internally or on our own systems. But for that we do, again, the total backup provides us assurance that that data remains, and also using them for total security, it minimizes us for the threat of breach into our system, knowing we have somebody that's 24/7 monitoring our server, which does contain, patient identifiable information that we need to safeguard. If you would want to put it in a nutshell, that's what the services with Nex-Tech has provided us. It's the assurance that someone else is there, sight unseen, assuring that we have secure, fast internet access, because that's vital for our business, and that they're literally just a phone call or an email away for questions, problems, and in fact, they call us if they see something going on their end. And that's, for us, has been priceless. I don't have to worry about certificates. I'm not keeping track of dates. And the other thing that actually has been a cost savings, because rather than having to pay the fees that we do for being a small business, we're able to get better price breaks because we actually go through Nex-Tech.